After abdominal surgery, such as a Whipple procedure or a distal pancreatectomy or a total pancreatectomy, there are some definite changes that would need to be made to the diet. And the reason for that is that the anatomy is changed. So oftentimes patients can't tolerate high-fat foods, and they also can't tolerate high-fiber foods. So when we look at the fat content of the diet, somebody that has pancreatic cancer, usually they can't tolerate greasy or fried foods in a general sense. Those are foods that will cause a lot of abdominal cramping and will cause pain. So those, after a major surgery, we would not have those as part of the diet. The other thing is the fiber content of the diet. We usually will restrict the fiber, meaning the roughage types of foods. So for example, I wouldn't have a patient eat a salad right after the surgery because that again is going to cause some cramping, but it also will cause some loose stools. And we really need the patient to be holding on to the calories as much as possible. So fiber foods such as fresh fruits and vegetables, whole grain foods, although those are good for us, are not usually recommended for a time after the surgery. We will give those foods back. We'll add those foods back into the person's diet as they tolerate it. And what that means is if the patient's doing well, they're eating a bland, low-fat, low-fiber diet, and their GI tract is functioning, meaning that they're not having a lot of bloating, they're not having a lot of gas, they're not having a lot of loose stools, then we'll add systematically one of those foods back every day until we can get the diet back to pretty much a general diet, still being a little low-fat. Now, the other thing that patients need to consider is that the function of the pancreas is to secrete insulin. And for some people, we'll have an issue with the insulin secretion after this type of surgery. If that's happening, then the diabetic parameters usually will come into play as well. So in the inpatient setting, a patient will have their fingers tested, will have a finger stick done before the patient eats, and that will tell the nurse whether or not they would need diabetic medication to help control their blood sugars. For the diet, we're pretty liberal in our approach because we know that the appetite is poor. We don't want to overly restrict the patient. So other than drinking lots of juice, drinking lots of soda, we wouldn't have a patient do those types of things. But they can still eat regular foods. They still can have pasta, they still can have potatoes, and that can be a part of the regular diet. So from a diabetic perspective, it's more of a medically managed part of the care that we provide, but it's not really a diabetic diet per se. We rather would be a little bit more liberal in the approach.